Intracavernosal injections. So why do we need to do them? So if you're not able to get a good enough erection using a tablet like Viagra or Cialis, injections work pretty much 99% of the time. There is that 1% of men where it just doesn't work for, and it's usually because of anatomical issues. So I'm going to show you how to do an injection today. So where do we choose the right spot? I always tell men to look at the eye and draw a line down the middle. And then we look for that midsection. So you don't want to do too close to the head because it does hurt, and you don't want to do too close to the base. Really want to aim for this midsection. And it's always at a 10 or 2 o'clock angle. So it's got to be on an angle like that. If you go too straight into the side or too far down, it does hurt and you may hit the urethra. The medication that we use, it comes from a compounding pharmacy, and they usually give it to you in a vial. So every time you want to have an erection, you do need to draw the medication out of the vial. How do you do it? Very easily. So what you need to do is get an alcohol swab at the top of the vial and let that dry. And keep the swab because you want to use it to freshen up the area. Then you get your needle, and please use a fresh needle with every injection. So you get them out, take the cap off, and the most important thing to do when you draw medication out of a vial is to use it on a flat surface, because if you try and do it that way, men have more chance of poking themselves with a needle, or the needle actually bends. So keep it nice and flat. Turn the needle upside down and just go straight in. Once you're comfortable, then tip it upside down and look at the numbers, because you'll always be told how much to draw back. And so you draw far back and make sure that the actual syringe is filling up with liquid. When you're happy, and if you say are injecting 30 units, then you just squeeze the excess back into the vial like that. And we always go to the top of the plunger on the line, not the bottom. Once you're happy, take it out, and this is ready to go. Now we need to do the injection. So before you do the injection, make sure that you lean your bottom against a kitchen counter or the bathroom counter, because this allows your pelvic floor to relax and for you to stretch your penis out while you're doing the injection. So we look at the eye, draw the midline, and again, like I said, we're looking for that 10 or 2 o'clock angle. So you get your swab. If you've got a foreskin, make sure you pull it right back so that it's out of the way. If not, you just swab away. Then you get your needle and you do it in a fairly swift motion. So you find your spot and you just go straight in. Once you're in, push the medication in fairly quickly, take it out, and hold the base super tight for 1 minute. And don't hold it that way. It's over the top. Why? Because the testicles get in the way. And you hold it nice and tight for 1 minute, because this allows the medication to start to swirl and start to work within the sponge. If you don't hold it, the medication will escape. It does nothing to you, but you want it to work in there. After that minute, then you start to massage it through. And within about 5 to 10 minutes, you'll start to get that normal erection happening. So I hope that helps you do an injection.